Welcome to the deep dive. Today we're taking on a mission that feels both clinical and just profoundly human. We've gone through a really detailed interview with Dr. Phang Cheng Kar, consultant psychiatrist, and our goal here is to pull out the most crucial, the most insightful, and frankly the most inspirational takeaways about mental health care right now.
And this is, I think, such a powerful set of sources to work from. It really lets us look beyond, the usual, some checklists and clinical protocols.
Right.
This deep dive is really about the philosophy of care. We want to build confidence in the field of psychiatry by showing how it's evolved, how it's integrating, hard evidence-based medicine with this deep contemplative wisdom from the East.
Exactly. We're synthesizing the journey of a practitioner who has actually blended these two worlds. So instead of just a list of symptoms, we're exploring how real science and genuine compassion come together in, well, one of the most vital fields in medicine. It's a journey from the very foundation to the future.
That's it. And when we look at Dr. Phang's career, we see this deep commitment to the holistic model, the biopsychosocial approach. It means you're viewing the individual not just as a set of symptoms, but as a whole person. A person who is part of a culture, a history, a whole set of relationships.
Okay, let's unpack this, starting with that foundation.
Let's do it.
We're looking at a 51-year-old consultant psychiatrist at Sunway Medical Center. His professional identity is explicitly built on integrating psychiatry with mindfulness and compassionate care. That sets a really high bar from the start.
That integration is the absolute core feature here. If you look at the qualifications, you have the BSc, the MD, the Dr. Psych. That's the essential, rigorous clinical baseline.
Standard stuff, yeah.
But what really makes this approach stand out is the specialized, extensive training in all these mindfulness-based therapies.
And for anyone listening who might not know the jargon, can you just quickly clarify what those mean? We've seen acronyms like ACT, DBT, MBCT.
Absolutely, and they're crucial. So ACT is acceptance and commitment therapy, DBT is dialectical behavior therapy, and MBCT is mindfulness-based cognitive therapy.
Okay.
And these are not, soft, unstructured therapies. They are evidence-based, highly structured interventions that use mindfulness as a core tool to help people manage difficult thoughts and emotions without being, completely overwhelmed by them.
So you're treating the mind, but you're also training the mind. And it goes beyond Western models, right? Dr. Phang also drew a lot from figures like Ajahn Brahm and Thich Nhat Hanh.
Precisely, and that creates a bridge. The result of this unique blend is something really practical. It led to him founding MINDFULGym. It's a Malaysian stress reduction program that's actually supported by the Ministry of Health.
Wow, that's huge. A model that's both evidence-based and nationally supported. It's described as being kind, culturally grounded, and it merges mindfulness, CBT, and neuroscience. It sounds like proof that holistic practice can be standardized.
And that brings us to the career journey itself. You see 16 years of practice, starting out in the government sector, places like Hospital Kuala Lumpur, UPM, before shifting into private practice. The settings were totally different, but the central lesson, that stayed the same.
And what was that ultimate lesson, moving between those very different worlds?
The insight was that while the context shifted, government work is about broad populations and training, while private practice allows for more long-term psychotherapy, the core human experience didn't change at all. Human suffering and human resilience, they are universal. It doesn't matter what setting you're in or the socioeconomic background of the patient.
That universality makes the core guiding principle so much more powerful. It's a statement that I think can get overlooked in medicine. We can't always cure, but we can always care.
It fundamentally redefines the role of the clinician. It puts the focus right back on the relationship. And it ties directly into a concept that is really the cornerstone of modern psychiatry, case formulation.
Okay, we hear the term diagnosis all the time. But what does a good case formulation give you that a simple diagnosis, like, say, major depressive disorder, just completely misses?
A diagnosis is a label. It tells you what the condition is. Case formulation tells you why. It's a holistic story that answers three critical questions. What kind of person has this condition? Why did it develop in this person? And what factors are keeping it going?
So if two people have major depression, the diagnosis is the same, but their case formulation, one coming from childhood trauma, the other from, recent financial stress, is totally different.
Exactly, and that leads to radically different treatment plans. It forces you to see the whole person, their environment, their strengths, their vulnerabilities. It changes the practice from a clinical checklist into a deeply personal story.
Here's where it gets really interesting. If the whole approach depends on this deep connection, this narrative, how does a psychiatrist, who is human, with their own biases, maintain objectivity? And how do they stay current in a field that's always changing? Let's start with bias.
Dr. Phang is very direct about this. Bias is unavoidable. It's part of being human. The solution isn't to pretend you're objective.
Right.
It's to cultivate mindful awareness. That's the clinical tool you use to combat bias.
So how does that actually work in a session with a patient?
It takes humility, self-reflection, supervision, and compassion. Mindfulness lets the professional take a pause, that critical little moment, to notice their own assumptions, their preconceptions, or even just their internal reaction to a patient's story.
And then
You consciously return to the patient with pure, open-ended curiosity. It shifts your internal question from, what do I know about this condition, to, what is this person trying to tell me right now?
that sense of curiosity seems to be the engine for continuous learning, too.
Yeah.
I mean, the list of methods for staying updated is huge. Journals, guidelines, research, learning from colleagues, even using AI as a learning partner.
And the philosophical guide here is what makes it all sustainable, keeping a beginner's mind. This is a profound concept drawn right from that contemplative tradition.
Can you give us a quick analogy for what a beginner's mind means in practice?
It means you approach every single patient, even if you've treated 100 similar cases, as if it's the very first time. It stops you from getting complacent. It forces you to question your own assumptions, and it ensures you truly hear the unique experience of the person in front of you, rather than just overlaying a template.
That focus on humility and learning is so important, especially when you think about the scope of the problem. So let's try to nail down the definition of mental illness itself.
It's defined as emotional, psychological, and behavioral disorders that significantly affect how a person thinks, feels, and acts, conditions that disrupt daily life. But, and this is a big but, we have to stress the importance of context.
Why is the context so important there?
Because definitions carry so much cultural weight. The way a psychiatrist explains mental illness to a patient has to be culturally sensitive. The way they explain it to the public needs to reduce stigma. To students, it needs to be scientifically rigorous. There is no single one-size-fits-all definition.
And with all this focus on healing, how do we actually measure success? It seems like just reducing symptoms is, well, it feels limiting.
It is severely limiting. Success has to be holistic. It includes reducing symptoms, yes, but it must also include concrete markers, improvement in daily functioning, the ability to prevent relapse, and, maybe most importantly, the return of meaning, joy, and connection.
I love that idea. The discovery of new, unexpected strengths. It completely reframes the goal.
The key takeaway here is incredibly positive. I think it should be inspiring for anyone considering this field. Healing is the presence of well-being, the presence of those positive things, not just the absence of illness. You're building something new, not just taking something bad away.
That's a phenomenal way to put it. Okay, shifting gears a bit to cultural trends. We hear so much about the conversation around mental health changing. Are young people today really more accepting of psychiatry?
The trends are overwhelmingly encouraging. The younger generation is more informed, they're more open, they're far more willing to seek help, and crucially, they know the right terminology. They are driving the change.
But with that acceptance, there's a challenge,
Right.
especially with the generation gap.
Exactly. While the youth are open, their parents and older family members often struggle with this inherited stigma. They might see symptoms of anxiety or depression as weakness, or an attitude problem, or just bad behavior. And navigating that gap is a constant, necessary challenge for clinicians.
Let's use that to directly debunk some of the classic myths that hold people back.
Yeah.
What are the big ones Dr. Phang runs into?
The first, and maybe the most damaging, is the idea that psychiatric medications are permanently addictive. This fear that once you start, you can't stop is pervasive, and it stops people from getting necessary, often short-term, relief.
And what about the idea that psychiatry is only for, the crazy, or that psychiatrists just hand out bills?
That's the second major myth, that it doesn't address the root cause of the suffering. It completely ignores the holistic, personalized, integrative approach we've been talking about, the one that uses case formulation.
And finally, that practical fear that having a mental health record will somehow ruin your job prospects.
That is firmly debunked. Mental health records are highly protected clinical information. The reality is that good, modern psychiatry is dedicated to privacy and personalization, which completely contradicts these harmful, outdated ideas.
So now we have to look at the system itself. If we know this holistic path is best, where are the biggest gaps? What needs to improve right now?
The biggest gap, stated unequivocally, is the lack of accessible and affordable psychotherapy.
The talk therapy part.
Yes, pharmacotherapy, medication, can be provided quickly, but the biopsychosocial model demands that medication be paired with consistent psychotherapy and community support.
So if the research all confirms that combined care is better, why is the system failing to deliver that psychotherapy at scale?
It really boils down to systemic constraints and manpower shortages. Quality talk therapy is time-intensive. It requires specialized training. The system is often set up to treat immediate symptoms efficiently with medication, but it just lacks the resources, the number of therapists, the time slots to provide that true psychosocial care to everyone who needs it.
It's clear that mental illness is much more visible now. Is that mainly because of overdiagnosis, or is there something else going on?
The source material is clear that it is not driven primarily by clinical overdiagnosis. Better awareness, less shame, better education, and let's be honest, higher stress levels in modern life mean more people are willing to seek help.
Right.
The systemic concern, as we just said, is over-medication and the under-provision of that crucial psychosocial care.
So what does this all mean for the future of treatment? Let's talk about the tools, especially the most controversial one, medication.
When you address the scrutiny around medication, Dr. Phang emphasizes it's always just one part of a comprehensive plan. The integrated model is the key to managing that fear.
Okay, so can you give us a clear picture of that model? What are the supporting pillars?
So medications are used if needed to stabilize symptoms, but they are supported equally by psychotherapy, robust family and social support, and significant personal effort and lifestyle changes.
Like what?
Things like mindfulness, strict sleep hygiene, exercise. When patients see that medication is just one tool within this whole framework, their anxiety about starting it usually drops significantly. A tool is only as good as how you use it.
And going back to the younger generation, their high mental health literacy is just a massive shift. They speak the language of anxiety, trauma, burnout, boundaries, things that were clinical jargon not that long ago.
Absolutely. This might be the greatest sign of progress in public health. This literacy means people can recognize distress faster and opens the door to prevention instead of just waiting for a full-blown crisis. It's a huge step forward.
With technology changing everything so fast, how do psychiatrists adapt to new things like cyberbullying or even a term like AI psychosis?
Dr. Phang sees this through a historical lens. These aren't fundamentally new forms of human suffering. They're just new expressions of timeless symptoms. Bullying becomes cyberbullying, social anxiety becomes social media anxiety. Delusions might now incorporate themes of AI or advanced tech.
So the underlying psychological structure is the same, but the language and context have changed.
Precisely. Which means professionals have to constantly update their understanding, their language, their tools to stay relevant. But fundamentally, they must remain compassionate because the root of the distress fear, isolation, shame, that's all the same.
Finally, we have to address that lingering perception that psychiatry, even though it deals with such profound emotion, can sometimes feel cold, a bit clinical.
Modern psychiatry, when it's guided by this integrated philosophy, is anything but cold. It's described as meaningful, human, and truly transformative. It actively brings in compassion-based approaches, positive psychology, relationship therapies, and culturally sensitive care that looks for a person's strengths.
And the ultimate conclusion.
The ultimate conclusion, which really defines this modern approach, is this. The heart of psychiatry is not symptoms. It is human connection. That is what provides the healing.
That is an incredibly powerful and inspiring note to end on. We've seen a field that's defined by continuous learning, by humility, and by a deep commitment to seeing the whole person, not just a diagnosis. It's an evolution we should all feel really confident in.
It offers immense confidence. And for you, the listener, here are 3 actionable take-home messages from what we've talked about today. First, remember that guiding principle of radical humanity. We can't always cure, but we can always care. Connection is just non-negotiable.
Second, redefine success in your own life. Healing and well-being are holistic. They're measured by the presence of positive things, meaning joy, connection, not just the absence of symptoms. You have to actively build those things.
And third, be part of that cultural shift. Stigma is shrinking because the younger generation is leading the charge on mental health literacy. Embrace that momentum. Use those terms, anxiety, burnout, boundaries, with openness. That's critical for the whole system to improve.
If the core of psychiatry is human connection, consider this final thought. How can we apply that principle of contemplative wisdom, that deep curiosity and humility of the beginner's mind, into our own daily relationships right now, to build more resilience and understanding in our own communities. That willingness to just pause and truly listen, it can change everything.